Hi, I'm Dr. Mike Roizen. We're going to talk about today wellness, what the Cleveland Clinic has done, why we've done it, and what for you, the practicing physician, this means, what you can take away from it. The outline I'll follow is why we did it, what we've helped caregivers do, our own caregivers, what's available to you to take for your patients or for your practice, and what do we plan on doing next. Why did we get here? Well, we got here because as a medical student in 1970, we had to take a course in health economics. Now, none of us wanted to take that course, but UCSF said, you're going to take it, and as a senior, all of us took it. And what was interesting is the health economist said, we're spending 7.2% of gross domestic product in 1970 on medical care. That's up from 5.2% in 1960. And if we keep going at this rate, we'll hit 12% in the year 2000, and we'll lose our manufacturing base in the United States. And we said to him, why will we lose our manufacturing base? And he said, because the United States is 2 to 3 times more expensive than Mexico. We didn't know anything about India, China, or Japan in that era. 2 to 3 times as expensive as Mexico. And when the differential gets to be 8%, and that's what it would be in 2000, then jobs move to the cheaper area. Well, what happened? We beat that. We hit 12% in 1990, and we lost our manufacturing base. We're much worse off than that now. We spent someplace around 18.3%, maybe 18.6% last year. And if we keep going at this rate, we'll hit between 20 and 28% in just 4 years. That's undoable, which means we'll either get rationing. You will be told what procedures you can do, what procedures and tests you can have for patients or not have, or we'll get rational. What do I mean by that? Well, chronic disease is the major driver of this. And 4 things, which we'll come back to, are responsible for 81% of hospital admissions, 91% of all prescriptions, 76% of physician visits, with an average cost for everybody of $6,000 extra. That means that if we're spending $12,000 per person, $6,000 of that is for chronic disease that we could decrease. Or even if we're spending $9,000 per person, $6,000 of it could be decreased. We have twice the chronic disease of developed Europe. Look at this, 80% more high blood pressure, 110% more heart disease, 40% more type 2 diabetes, 800% more stroke at the same age, same diagnostic criteria. Even if you look at the bottom, cancer, non-skin cancers, we have more than twice as much as developed Europe. Arthritis, we have more than twice. Only one thing we have less of, and that's osteoporosis. We're so fat, we have to get strong bones. But the basic message is that a lot of medical cost is caused by these 4 factors. In fact, the CDC says 70 to 75% of chronic disease is caused by 4 factors: tobacco, food choices and portion size, physical inactivity, and stress. Let me spend another second on that. Just 4 things: tobacco, food choices and portion size, the physical inactivity of your patients or you, and unmanaged stress account for 75% or contribute significantly to 75% of the chronic disease. And that is what results in those incredible costs and, if you will, use of our facilities. The CBO, approximately 2 years ago, estimating that we would grow our GDP at 2.5% per year, said, what will happen to our budget, the federal budget, over the next 70 years? And what they found was that that blue line is everything non-healthcare, even Social Security and disability. Those go down as a percent of GDP over time. Only one problem results in our budget deficit. Only one problem results in fact, our non-competitiveness with other countries. Only one problem we have to solve to have a stable federal budget, and that's the healthcare costs. About 15% of that is the aging of the population, but 85% of that is those 4 factors. It's chronic disease. So the reason the Cleveland Clinic did this was it said that if we're going to continue to lead in healthcare, if we're going to help the practicing physician decrease the cost of medicine, we have to decrease the influx of chronic disease, because that's what's driving that red line. And really, when I talk about wellness in the Cleveland Clinic, it is the legacy, or part of the legacy, and he's done so much, but it's part of the legacy of Dr. Toby Cosgrove, because he said that part of the responsibility of the Cleveland Clinic is to continue to help innovating and leading. And he said, we can't really get more efficient to knock down 50 or 60% of the costs. If we're going to knock down the costs to be competitive, we've got to decrease the influx of chronic disease. And it's not just America that's getting obese. This curve was created in 1990, and you can see every other country, including the United States, has exceeded these targets. Australia, believe it or not, has recently bumped up with our obesity rates, and Mexico has overtaken us. So it's not just the United States that has this problem of high blood pressure, type 2 diabetes, metabolic syndrome, joint problems, etc., all caused by obesity. Every other place has it. We're just leading the parade. Now, most people think as they get older, they have a declining quality of life. Maximal function of everything we can measure hits our peak between 25 and 35 and declines about 5% per decade after that. What declines? Your lung function, your liver function, your heart function, your kidney function, even your IQ. This is the IQ of Harvard physicians. This study started in 1952. I think it's still going on. But you notice the physician's IQ declines on average 5% every 10 years. But if you do the error bars, you'll notice a whole bunch of them don't have a decline. In fact, that's the key thing. How do you assure that you're one of the 25% that don't lose IQ points as you age? And it's not just IQ, it's everything. That is, that solid red line that depicts our quality or our function of life. Under the age of 25, gene penetrance is so strong and so powerful, those genes take you where they want you to go. But over the age of 25, whether you're way above that red curve or below it, are your choices. And they're your patients' choices. And so part of what we said is, how do we motivate our employees? How do you motivate your patients? We'll get to that. To in fact live at the top of their curve so they have less need of chronic disease services. You know, Dr. Oz and I put cartoons in our books. We can ask you why we do, and Craig could tell you why we do, but Craig's not in your room right now. The reason we put cartoons in our books is so guys will read them. That's right, 85% of health improvement books, wellness books, healthcare books for the general population are bought by women. We wanted to get more, so we said we got to put cartoons in it. So we got a cartoonist who ends up being the chief cartoonist for Mad Magazine, who did our cartoons like this. And if you look at that yellow figure as they get acutely ill and go to that bed, that's what the great hospitals of the world do. Your hospital, probably the Cleveland Clinic. You go down in quality, and then you go down in quality of life, and then you bounce up. But if you notice that guy with the cane, the curve they go to isn't a great curve. What's possible is going to that upper curve where the red guy is and living with wellness, living at the top of your curve till you get struck by lightning and die. And that's what we think can happen. What this really reflects is great compression of disability. That is, those two curves, the one going down and the one with the red guy, those differences are if you have more great years with less years of disability. And it's quite possible. We're going to show you what had happened.
Today, we're tackling meat. Rocco's a meat-loving cowboy, and I'm about to ask him to give up meat and animal products for 28 days.
I'm 53 years old, and actually wondering how long I'm going to make it.
The best way for us to do this is take it to the truth tube. Your blood sugar was 172. You're not borderline anything, you're just a diabetic. Your waist size, 49 inches. And your weight, 265 pounds. When I saw these figures, I was very alarmed. And when I'm scared, the patient needs to be scared too. Do you see that?
Yes, sir.
That's plaque inside your arteries. You are in the 97th percentile, which means almost no one has more plaque than you. In fact, you have the heart of an 85-year-old.
Is it reversible?
Yes.
Good.
You need to get serious about this. When I found out Rocco's health was so critical, I knew I had to send in the one man who would get him on the right track. He's a brilliant doctor, an exceptional motivator, and my best friend. Take a look.
I'm Dr. Mike Roizen, and here at the Dr. Oz Show, I'm known as the Enforcer.
Hello, it's Rocco.
Rocco, this is young Dr. Mike. Of all the people I've talked to, the one that concerns me most is our meat-loving cowboy, Rocco. So I'm going to Arizona myself to see how he's doing.
Dr. Mike.
How are you?
How are you?
Good, you look good, man.
Oh, my God.
Oh, look at this. It's pretty good.
I got a lot of peaches and apples, cucumbers, leafy green vegetables.
This is great.
Yeah, exactly. Here's the freezer.
You know, there's no meat in here. I don't see any. Are you keeping up with your steps?
Yes, right now it was 10,000 the first month, and now I'm going to start doing 12,000. Keep my pedometer with me. 4,500, and it's only 20 after 12. But yeah, everything feels different. And it's taken a huge weight off me personally. I didn't realize what effect mentally looking like that was doing to me. If I can do it, anybody can do it. Can you come out next month? Because I'm afraid if I lose you, I'm going to mess up.
You've won me for life.
Okay,
You know, you
good.
got my email for life.
Oh my. So, it's been 28 days. I gotta say, everywhere I go, people stop me and they ask me about Rocco. I can't wait any longer. I'm gonna see what he looks like. Rocco, come on. I gotta say, Rocco, it's impressive. When you left here, I really was very, very concerned. As you went back to the airport and took that long flight back home, what was going through your mind?
That was brutal. I went crazy in the airport because as soon as I left, the pressure was off. I did the TV show. I got 28 days. The first test, I passed by one fast food restaurant. I passed by fettuccine Alfredo. I passed by bacon and smells. And I decided right there and there, I was only a half hour away from here. And I said, am I gonna live or am I gonna die? Am I gonna spend time with my grandchildren? Am I not? And I got a bag of nuts and a container of juice. And that was the first time in my life I did that.
I'm proud of you. It's a first step. What is it about Dr. Roizen, the enforcer, that sort of got you over there? I'm asking this question not just for you, because I know there are going to be as many people as before that show going to call me now and say, I want to do what Rocco's doing. What clicked for you?
The knowledge that he had and the way he came across. I have never had a grown man push me around a little bit. And I push people around a little bit. But in other words, it wasn't that he was doing it because I was a subject or I was a patient. He did it for me because he knows a way of life that I needed. And that's the way he sold it to me. And it was through his care and his love and his consistency. And again, it wasn't anything I couldn't do myself. Sure. But the fact that there were other people in it with me. I have an eating disorder. You know, there's no fat guys, nobody's out to save fat guys. But I have an eating disorder. It's a problem. I learned it. It's taken years to create it. And I have to stay away from the things that created it. No different than drinking. No different than if I were addicted to drugs or I had an addiction to some behavior. I have to change the behavior.
You want to see if it worked, everybody?
Yeah.
Rocco, you want to know?
No, I'm going that way.
Okay, come on up. Dr. Roizen wants to check your waist size for him. Oh, yeah. You've been there before.
Yeah.
So you know the Truth Tube rules. All right, Mikey, check his waist size.
Hold it right there.
Good.
Now, Rocco, we want you to suck in.
Get the camera here, guys.
Because you're going to
this.
anyway.
I don't want anybody saying
Whoa.
it's not real.
43. Fantastic.
When you came on the first time, I was crystal clear on the fact that I didn't care about your weight as much as I cared about what was happening inside of you.
That's correct.
Right, so the first number we talked about was your glucose, your blood sugar. Because diabetes is a big deal to me. It's like pieces of glass shards scraping at your insides. You don't want that happening and not knowing about it. So you were a diabetic. Let's see what your number is now. Your glucose on the test we did is 99.
What happened in 28 days? Yeah, literally 28 days. Rocco got rid of his type 2 diabetes. His hemoglobin A1C came down over the 90 days to absolutely normal. In 2 months, he got off his antihypertensive pill. That's one thing you got to watch for if you're coaching people every day and they're doing well on physical activity and food choices, portion size, managing stress. He didn't have tobacco, but if they're doing that, you're going to have to decrease their medication for hypertension. And in 2 months, he got rid of his osteoarthritis. And he started, when we studied him again, to pull the plaque out of his coronary arteries. What do you think it did to his physiologic age? He's at least 10 years younger. What did it do to his medical costs? More than 90% decreased. We do it by a coaching process. You saw me on if you will, use a phone. The only reason I used a phone was we did a TV show. Really what happened was this email system that's available to anyone. So he emailed me a note, if you will, saying I want to start and some facts about him. I emailed him back, and then an automated system took over. I oversaw it so that nothing came out wrong, but it was daily emails as he coached him for the 28 days. We actually coached him for 6 months as he developed those habits and stayed with them. In fact, looking at the dollar cost of this, losing waste and helping people lose waste are patriotic, and they're the best deficit reduction and job creation programs you can get your patients to do, or you can do in your practice. That's because those 4 factors cause 75% of chronic disease. And if you get them to be physically active, to know what food choices to have, as we did with Rocco, to manage stress and not get rid of tobacco, that is to get rid of tobacco, you can reduce that 75% of cost. You can save America's budget one practice at a time. So let me show you what happened with tobacco, which we did at the Cleveland Clinic, and then we'll go through the rest. It's the largest healthcare cost. 1 in 5 Americans still dies from tobacco-related disease. It's the largest Social Security and the largest pre-Social Security disability cost. The bad news is that the smoker lives about 10 years shorter period of time. There are 13 studies on this, doing Kaplan-Meier survival curves as this shows, lives about 10 years less than the smoker. That is, the smoker lives about 10 years less than the non-smoker. If that's all that happened, you wouldn't care about it from a cost standpoint. It would be their choice. But much more happens. The disability risk, so they die 10 years earlier, but they also have 18 years more disability on average than the non-smoker. And you pay for that with your dollars, tax dollars, and your insurance dollars. And every patient in your practice is paying for every smoker, because the amount we collect in cigarette taxes pays for only about 1/16 of the total medical costs that that smoker has. And as I said, it's the largest disability cost. The great news is that if you get people to stop smoking, their Kaplan-Meier survival curve and disability curve is superimposable over the non-smoker if they quit before age 35 or before 20-pack years. What happens? How great a problem is secondhand smoke? Well, let me show you this in Pueblo, Colorado. After they banned smoking in Pueblo, Colorado, Couldn't do it any place other than inside your house. 27% reduction in heart attacks in 18 months in the non-smokers, and a 41% in the smokers in the non-smokers in 36 months. Secondhand smoke is this huge problem that we don't recognize. No change in the control area. What about in Scotland, where they banned smoking in public? 17% reduction in heart attacks and acute coronary syndromes in 18 months. No change in England, which was the control for that study. Monroe County, Indiana, banned public smoking. 77% reduction in heart attacks in 2 years in the non-smokers. Why am I going through this? Because smoking isn't just a problem for the smoker. It's for everybody else. And it's not just a financial cost for everybody else. It's a real cost because of plaque rupture when they get exposed to secondhand smoke. How about in public places in Minnesota? 33% reduction in heart attacks in the non-smokers. 17% reduction in cardiac deaths in the non-smokers, just by banning public smoking. What about in Cleveland Clinics County? We have a number of places. We got 5 hospitals in Abu Dhabi, one big one going up, and we have a facility in Toronto and another facility in Beijing, and hospital in Weston, Florida, and Las Vegas. We have a brain center. But our largest practice is in Cuyahoga County in the state of Ohio. And in 2006, we prohibited smoking on our campuses. You say, is that fair to the people? Sure. It's in fact not ethical to allow smoking on your campus because you're encouraging people to get heart attacks. You're encouraging secondhand smoke to rot its damage. But we said we had to offer free smoking and tobacco cessation to our own employees to help them not smoke. And we did it with special signage, if you will. And we did it with a program that had an 84% success rate in helping people quit smoking. So no smoking any place. We offered free smoking and tobacco cessation programs, and a lot of our employees took us. And then we did a public effort where they had a public campaign. You know, someone, maybe Big Tobacco, decided to try and get a no on 4. We wanted a yes on 5 campaign. Yes on 5 was to ban public smoking. No on 4 was going to be a, if you will, a state constitutional amendment to force smoking being allowed in public places. Pretty clever, those guys. But the Cleveland Clinic decided to get involved, and we had about a 65% vote no on 4 and a 65% vote yes on 5, which helped smoking be banned in public places. Toby Cosgrove then said, we've got to do something for all these people we've tried to help quit smoking by this ordinance. Let's offer free tobacco cessation to anyone in Cuyahoga County who's not covered for such by insurance. And we did. And for 6 months, we helped something over 8,000 people get off tobacco and stay off it. This is the curve. The red line is our county. The deep blue is, in fact, all of Ohio. As you see, we were higher than the average county in Ohio. We had 26.5% when we started this effort. And that big decline is because we offered free smoking cessation to the employees of our Cleveland Clinic and to anyone else who wanted it in our county. And we got down to 15% by 2009 in our county, the lowest county in the state, below the national average. We then said we shouldn't hire any smokers. It's not easy to do that, but it's legal to do that. And we did a lot of messaging about that. And if anyone was going to get a job, we offered them free smoking cessation so they could get back in the employee pool if they wanted it after they quit. A couple people probably just applied to us for jobs just so they could get free smoking cessation. But in any case, we got more people applying to us because of the policy than staying away from us because of the policy. And you can say, is it ethical? Darn right it is. It's not ethical to hire smokers because you're condemning everyone else who works at your place to secondhand smoke, to higher costs, and to your whole company. All of their jobs are at risk when you hire smokers because you're becoming less competitive. The tobacco use went from 15.4% to 6.8%. It's probably under 6%, and we think it'll be under 2% in 2020. Unfortunately for the state of Ohio, a prior governor, not the current governor, but a prior governor, took all the money out of tobacco prevention. Every penny of the $40 million that was there. What's happened? We now have 25%, up from 20% of Ohioans, 25.4%. That costs us $1 billion more. So by taking away $40 million in prevention, 9 years later, when that disability of the extra smokers kicks in, we're going to be paying $1 billion every year for that governor's lack of foresight. Prevention does work and does save taxpayers money. We even went to the state, Dr. Cosgrove and I, to go to the regents to ban smoking on campuses. And the regents now voted unanimously 3 times. And I'm happy to report Cleveland State University, one of the state universities, has gone smoke-free. By the time you see this, or at least January 1st, 2014, Ohio State is going smoke-free. So you've got to do something for your state. You can do this. One person did this. You can do this too. The second thing we tackled was physical inactivity. Now, we should have done all these things much faster, but we aren't smart enough to do them much faster. Let's take a break right now,